Thank you very much for asking me to come and speak to you today. I've been asked to speak about the impact of euthanasia legislation on the care of older people. And I'd like to propose to you that as opposed to what's commonly said out there about dying with dignity and mercy killing, that it's actually going to be just the opposite. There'll be time for questions afterwards as well, and I'd welcome your input into some of the topics that I'll be bringing up. Okay, so I often get asked, what is a geriatrician? It's a relatively young specialty. So I'm, as was mentioned, a specialist in the care of frail older people, and had to do extensive training to qualify as a specialist. And most of my work involves dementia, stroke, Parkinson's disease, falls, delirium, cancer, and basically all the things that happen to people over the age of 70. It makes you feel tired just hearing about that, doesn't it? Now, which is the laser pointer? Is it the green one? Right, good. This is a chart that warms the heart of any geriatrician. So the light-coloured bars are what the population was like in 1989 census, and the darker coloured bars are 2009. And what you can see is that the population is ageing. So it's really pointed us to the success of our medical system. So every geriatrician likes to know they're going to be still in business later on. So we're all getting older. Isn't that a wonderful chart? Wouldn't you like your superannuation to do that? That's fantastic, isn't it? I love it. Okay, so people are living longer, and that's a fantastic thing. And don't let anyone tell you the opposite. And when a politician gets up and says the old people are clogging up our emergency department, that's a load of rubbish. I can explain why later on if you need to know, but that's a bit off the topic. However, of course, as people are ageing, so is the incidence of age-related diseases such as cancer, dementia and Parkinson's. And a lot of these illnesses, just like any illness, can cause human suffering. And as you know, some people are proposing that the answer to this is euthanasia. And bills are already introduced into Australian states, and as you heard earlier on, soon to be into the National Parliament. And I urge you all, everyone must write or speak to their senators. It's absolutely imperative that you do that. Okay, so firstly, what is euthanasia? And it's important that you understand what it is and what it isn't, because a lot of the way that euthanasia proponents like to fool people is to cloud what the meaning of euthanasia is. Okay, there's two types of euthanasia. There's two forms in which it occurs. One is direct medical killing. So a doctor draws up a syringe, injects it into a patient, and the patient dies. The other type of euthanasia is physician-assisted suicide, where the doctor writes the prescription or provides the medication, and the patient then either injects themselves or whatever the mechanism of death is. So one is the doctor injects, the other one is the doctor prescribes the dose and supplies it. Both of these are illegal in Australia at the moment. Okay. Now, you also need to know what euthanasia isn't. And the term you've got to be very careful of is so-called passive euthanasia. Yes. Thank you. So passive euthanasia actually doesn't exist unless you're talking about something that I call criminal neglect. If you just leave someone who comes in with a chest infection and you let them die, that is not good medical care. That's just being criminally neglecting. Okay, I'm talking about what people call palliative care and saying that that is passive euthanasia. Okay, allowing the natural course of the illness to take its effect. Okay, I'll talk a bit more about that later, or perhaps some of you might have questions and I'd be prepared to answer them. So understand the difference. Okay, euthanasia is the direct killing of a human being. It's not, that the known course of the illness is that after 5 years you die of this cancer. That's completely different. Some countries allow medical killing, and some places allow physician-assisted suicide. I've listed them there for you. But the good news is that many countries have rejected euthanasia. Okay, Western Australia, South Australia, Victoria, Scotland, Hawaii, Ireland, Mexico, Israel, and Australia, of course, because the Northern Territory legislation was previously overturned in, I think, 1999. Sorry. I'd have to check that. There was some, it was a little bit wishy-washy. I don't think they outright rejected it. But anyway, the point is that a lot of places have rejected it, and we can hold the line if people let the politicians know what we want. Okay, so what are the big questions about euthanasia? And these are some of the questions that proponents try to say that this is why we should have euthanasia and should legislate for it. Is it the best medical care we can offer sick, suffering or dying people? If it's not the best medical care, then we shouldn't be doing it. Okay, why should we be offering second best medical care? So is there a better form of medical care than euthanasia? Is it the most loving response we can offer people who are unwell or suffering? And if it's not the most loving response, we shouldn't accept it. We shouldn't accept second best. Should we... Oops, sorry. I know nothing about technology, sorry. Should we legislate to bring it in? Will it allow sick patients to be more autonomous and die with dignity, which is what the proponents say it will do? What about just, surely we can have safeguards to make sure that it's voluntary? Okay, they all talk about the great safeguards that are going to be in place. And do doctors and nurses agree with it? And will it give doctors and nurses more certainty in the way that they that we deal with our patients? Okay, so these are the questions. And if these are the questions you should ask yourself. And if the answer to these is in the negative, then it calls into question a lot of the things that the supporters of euthanasia are saying. Now, before you answer any question at all, you've got to form the framework that you're going to use to answer the question. Okay, so Christians like to say that we're forming our conscience. Okay, so how do we form our conscience? Now, in any decision in life, you've got to make a framework in which you're going to use to answer the question. So, a judge, for example, when he's telling a jury, when he's giving instructions to the jury, instructs them about what they're meant to take into account and not take into account. Okay. If you're going to save for your retirement, you need to ascertain what your goals for retirement are and what you think is a good investment or not, and then make a decision. You don't just make a blind decision. Okay, and the same thing for a Christian. You've got to weigh up your conscience in order to guide your life decisions. Okay, a thief weighs up the chances of getting caught or getting away with the heist before he decides to rob the bank. Okay, so you've got to work out where you stand and what are your core values. So the answer you get will depend on how you form your conscience. Okay, some people like to exclude fundamental truths and natural law when they're forming their ideas on life. Okay, so what about for a Christian? How do we form our conscience? How do we make how do we decide on, well, this is where I'm coming from? Okay, because that'll help you work out where you're getting to. First, God is the creator of life. That's what we accept. So all life is special. And I mean all life, okay? Animal, vegetable and human life is all special in some way. Okay, and the wanton destruction of any life is wrong. You just, if a rose is growing and you just walk along and say, I'm going to use Roundup on it for no reason at all, that's the wrong thing to do. Okay, but humans are made in the image of God, so human life has a special meaning above all other forms of life. And this is actually self-evident to any open-minded person. It doesn't matter whether you're a Catholic or a Christian or any other religion. Okay, it's part of natural law. It's something that's innate to us as human beings. So even the most reasonable atheist, and I have to underline reasonable because many of them are unreasonable, even the most reasonable atheist would say that a human life is worth more than a lizard's life, for example. Okay? God took up human nature and came to earth, and therefore he knows what we're going through because he experienced pain and suffering and death. Okay, so the first thing to understand is that God is the source of life and human life is special. The second principle is that a morally unjust act can't be committed in the name of achieving some good outcome. Okay? So, put simply, to a Christian it means that the end does not justify the means. So taking a life, for example killing a sick person, can't be morally justified in order to achieve some other good. Okay? Some other supposed good. If you're trying to relieve suffering, it can never be justified by giving someone a lethal injection. Okay? So other examples of that in real life, you can't justify getting behind the wheel drunk because you're going to go to a Vinnie's meeting and help the poor. Okay? It's never good to do that. I'm not allowed to steal money to buy my wife flowers. Okay? So you can't justify a bad act by some other supposed good outcome. The third thing informing your ideas on life is that you're called to do what is right and good. Okay? However, if in the act of doing something right and good, that is wholly right and good, something unintended, an unintended consequence occurs, then there's no moral culpability attached to that. So if I give someone a medication, if you walk into the emergency department with pneumonia and I give you, and you're pretty much unconscious, and I give you penicillin, and I had no idea that you were allergic to penicillin despite trying my best efforts to find out, and you unfortunately are allergic to it and die, then I'm not morally culpable for that, am I? Can you see what I'm talking about? If someone has severe pain and I happen to give them morphine, which is a normal standard dose for that person's weight and kidney function, and there's some unintended consequence and the person dies, that's what's actually called bad luck. Okay? It is. It's an unintended consequence, and it's the principle of the double effect. Okay? It's a well-known moral principle, the principle of the double effect. But to people who don't have a Christian background, they would understand that as being bad luck. Okay? So if you act in a wholly good and wholly life-affirming way and something bad happens, that's not a sin. Is everyone with me on those three principles? Yes. Okay, so if you understand those three principles, it becomes a lot easier to answer all the questions that I asked about euthanasia. So is it, I won't go through them again, but you'll remember them, I'm sure, from the questions I just asked you. So firstly, is it the best medical care we can offer to sick, suffering and dying people? And if not, why would we legislate to introduce it? And if a better treatment exists, why not use that treatment? Well, there is a better treatment, and that's palliative care in the setting of someone with an advanced incurable illness. Euthanasia is the same as putting a pillow over their face. Palliative care is a much more complex and involved and skillful form of treatment, and it's very effective. So it uses medications to relieve pain and other symptoms. It employs caring staff who want to listen, advise and support the patient through their difficult times. It involves spiritual ministering to people to provide love, guidance and support. We encourage family members to be involved in the care of people. And we offer hope by showing the patient that they're worthy of our time and attention. Okay, a lot of patients say, oh look, I'm sorry to put you through this and I'm sorry to have to take up your time, but they need to know that yes, they're absolutely worthy of all the time that I give them. And a lot of people that have asked me for euthanasia have said, I feel like I'm a burden on others. So they need to be shown that they're not a burden on others and that they're fully worthy of all the time, resources and attention that we can offer. So most doctors, and myself included, did medicine to help others. Okay? Now there's a difference between curing and healing that I want you to understand. As a good doctor shouldn't attempt to cure everything. There are some things and many things that you can cure, but there's quite a lot of things that we can't cure. And that's where the other important aspect of being a doctor comes in, and that is to heal people. And they're actually completely different. You can actually cure someone without healing them at all. So, and I'm sure many of you would have experienced, surgery where the surgeon just couldn't be bothered giving you the time of day and just came in and grunted at you, and you were fully, cured of your arthritis of the knee, but you were not at all healed. And yet in other instances, and many of my patients haven't been cured, they've actually died, but they've been healed. They feel better as a result of the interaction. Okay, so it's important to make the patient feel better as well as curing them. And it's more important on the healing aspect than on the curing aspect. So doctors have incredibly valuable skills at healing, curing or relieving symptoms. Okay, and it's frankly insulting to suggest that all I can do as a doctor to relieve someone's sufferings is to kill them. Okay, I'm not trying to say that I'm any good at all, but as a doctor in general, we're much cleverer than that. Okay? And you've got to question the motive of a doctor that says, well, all I can do is offer them a lethal injection. You know, there's something wrong with that doctor's skills, training or ability, I suggest. So what I want as a doctor is a well-resourced hospital, caring staff to be able to give my patients full care and attention. And I want more funding for palliative care research rather than it being diverted into the false hope of euthanasia. Because that's what euthanasia will cause. Resources will go out of palliative care. What is the point of funding an expensive care like palliative care when a much cheaper option is available like euthanasia? So is it the most loving response we can offer patients? And if not, well, we shouldn't implement it. Now, I ask you, what demonstrates more love? Sitting with a patient for an hour, talking to them, exploring their feelings, and trying to comfort them in their time of need, or just giving them an injection to kill them? Okay? So euthanasia doesn't pass the smell test. Okay? There's something fishy about it. Okay? It so happens that the doctor has to spend less time, less attention, there's less resources required, less staff required, and it's all over and done with very quickly. That should make you feel very suspicious. If I could say to you, look, I can cure your cholecystitis, you don't need an operation or time in hospital or antibiotics, I just have to give you one tablet, you know, you'd think, this isn't right. And that's the same thing with euthanasia. People say, well, you wouldn't treat a dog like that, surely. And I say, yes, that's right. I don't treat humans like I treat dogs. Okay? So I don't put people down like I put a dog down, because I treat humans better than I treat dogs. Of course, we do care deeply for animals, and you don't want to see an animal suffering. So, in the case of an animal, you would put that animal down. But that's because in animals, suffering doesn't have any spiritual meaning. There's no opportunity for a dog to grow in its understanding of the world if it's got some terrible disease. Okay? Human life is made in the image of God, so every human experience, whether it's good, bad, painful, pleasurable, actually has some spiritual meaning and relevance to our Creator and to us. Okay, so there's no benefit in showing your dog I keep talking about dogs, but let's take a cat. There's no benefit in showing your cat its photos of its first birthday. Okay, the cat doesn't think, wow, that was a great experience. I'm glad you showed me those photos. Okay, it might help us, but that's the human experience side of it. But there's no benefit for the cat in having a pleasurable experience, and there's no benefit for the cat in having in going through a dying experience. It may as well just be put out of its misery. Okay, there's no opportunity for growth, no spiritual enrichment, no opportunity to bond with family members. These are the benefits that human suffering brings, and human pleasure. Okay, so all of our experiences as humans have benefit for us in some way or another. It's just whether we're open to that benefit. So I ask again, what shows greater love? Killing a person or helping them in their time of need? Okay, I mentioned that a lot of people think that they're a burden on others, and we need to relieve them of that. That is really the source of their suffering. Okay? And of course, I just mentioned that there's a lot of benefit to suffering, and a person's faith and strength can grow through times of suffering and illness. And in fact, many of my patients have actually come back to their faith after being away from the faith for many years, because I actually sat down and talked to them for a while. Okay, so people that hadn't been to church for 30 or 40 years, a guy started coming back to church again in his last year of cancer. So these are the great things that can be achieved when someone thinks that, when someone else might believe that the person's life has no value. So should Australia bring in euthanasia? Should we legislate to allow it? Well, apparently I'm told it's very popular. Okay, 85% of people think we should bring in euthanasia. So the typical question is, if a hopelessly ill patient in great pain with absolutely no chance of recovery asks for a lethal dose so as not to wake again, should the doctor be allowed to give a lethal dose or not? Well, okay, that sounds pretty reasonable, unless you'd formed your conscience, of course. But to the general population that doesn't bother doing that, it sounds pretty reasonable. But let me just ask the question in a slightly different way. If a doctor is so negligent as to leave his patient in pain severe enough so that the patient has to beg to be killed, should that doctor be allowed to kill the patient instead of seeking expert help or spending time working out what the actual problem is and the best way to help the patient? Okay, so if that was the question on the survey, do you think that there'd be 85% in favour of that? Okay, and often this is the problem. I was actually an expert witness. Actually, do I mention this? I was an expert witness in a case involving a doctor in a small country town that lethally injected 2 patients. And that happened, it was about 5 or 6 years ago. And that doctor, I read through the case notes, and it was clear that what the patient had. Okay, the patient probably had urinary retention causing the pain, a condition easily relieved by putting a catheter in. The patient wasn't examined by the doctor the whole admission. Okay, and then the doctor gave a lethal dose of an anaesthetic agent, which you would never ever do. It's a deliberate killing of a person. Okay, and that's what happens when there's supposedly no safeguards. Okay, so when there's no legislation for euthanasia, imagine what's going to happen when it's actually allowed. And that's what happens when no history is taken, no examinations taken, no trying to think, well, what's actually going on? How can I help this person? Let me put my skills and ability to use. Okay, what's going to happen is a lethal injection will occur. Okay, in any case, surveys of popular opinion, that's not a way to work out what to do in a certain situation. Okay, so if 85%, if 99% of people think it's a great idea, that makes absolutely no difference. It doesn't mean it's a good idea. Okay, so if we took a vote on, after the Port Arthur massacre, should we bring in capital punishment? Okay, 90% of people would have said yes, we should bring in capital punishment. But that doesn't mean that it's the right thing to do. Let's say if you had a survey and said, should we bring back slavery? And that was, yep, okay, 51% of people said yes. Should we bring back slavery? Okay, so just because something has popular support, it doesn't mean that it should be introduced as a law. And part of the reason why it's so popular is that many Australians, and actually even many healthcare professionals, would you believe, don't understand what palliative care is. Now, it's important for you to realise that euthanasia doctors and euthanasia advocates and a certain doctor that swans around talking about it, they actually don't look after sick and severely debilitated patients. Okay? Real doctors actually work in hospital, seeing 30 patients every day, looking after these people, going on ward rounds and asking them, how can I help you? What's the problem? Okay, we don't go on world tours, advocating death machines and sipping Chardonnay with our navel-gazing friends. Okay, so a real doctor is found looking after old, sick people. The guy that you see on TV all the time, he doesn't look after old, sick people. Okay, well, what about cases of extreme suffering? Surely it's okay if the person's in terrible pain and terrible suffering. Okay, but hang on a minute. Lots of people in extreme pain aren't dying. Okay, someone with multiple sclerosis or rheumatoid arthritis can conceivably have severe, terrible pain at the age of 30 and have 40 years to live. Okay, so that argument really doesn't hold water. This is actually an attack on old people, and old people with dementia, and patients who are perceived to be using up health resources. Okay, so it's not being advocated for these people, or hopefully it isn't. Okay, so extreme suffering does not necessarily equate with a terminal illness. Also, 100 years ago, we had very little in our armamentarium to actually resolve people's pain. Now we've got great medications, wonderful skills, almost, got at least 20 different pain medications that I can think of just off the top of my head that will help people, tremendous health resources, and now people are asking about euthanasia. Okay, so why is it becoming increasingly popular when it's actually becoming less and less necessary? Okay, perhaps in 20 or 30 years, it'll be, we may very well be able to assist all suffering or pain. I don't know, it depends on what's happening with research. None of that research will occur if euthanasia is allowed to come in. Now, what about, will it allow sick patients to become more autonomous or so-called, have control of their own destiny if we bring in euthanasia? And isn't it just a case of the doctor or me saying, well, I'm going to decide whether or not you suffer or not? Will bringing euthanasia in allow patients to have their own autonomy and decide when they're going to die? Well, if you look at the experience from countries overseas, the actual decision comes down to the doctor's decision, not the patient's decision. Okay, quite a few patients who asked for euthanasia in the Netherlands, you may be surprised to hear about this, but quite a lot of them actually didn't get euthanased. Okay, so it's actually not going to be the patient's decision. The doctor is the one that's going to decide whether or not to euthanize you. Not only that, but a lot of people who didn't ask for euthanasia were euthanased. Okay, in about 40% of cases, and this is when they did anonymous surveys of the medical and nursing profession, in 40% of cases, they didn't have explicit consent. Okay, so not only is it the doctor decides whether you get it if you ask for it, but the doctor will actually decide whether you get it even if you don't ask for it. The other popular misconception is that an older person can think, well, yeah, look, I've got this terrible pain and suffering and I'd probably be better off dead. But that's not how illness works. Okay, many older people in the terminal stages of their illness actually have dementia, delirium, reduced levels of consciousness. Okay, and they're not sitting around making rational decisions. We don't even allow them to write a will in that situation or to decide who gets, whatever of their possessions. And yet, supposedly, they're going to have autonomy to decide whether or not they should take a lethal injection. Okay, what about a baby or child with a terminal illness? What control do they have over their destiny? Okay, so in a lot of situations where euthanasia proponents are suggesting that we bring it in most cases, the person's not going to have the autonomy to be able to decide whether they want to be euthanized or not. And this question about being a burden to others. So will they actually feel that they have a duty to die as opposed to a right to die? So all that stuff about giving patients autonomy, it's a load of absolute rubbish. Okay? I give my patients autonomy every day. And any doctor who wants to can give their patients autonomy without offering them euthanasia. How do we give autonomy? We give autonomy by giving information to a patient. Okay, knowledge is power. Sitting down, talking to them, explaining what their illness is like, what to expect. A lot of it is fear of the unknown. Okay? So, So showing them that they're not a burden, showing them that they are worthy of your time and attention, giving them information about their illness. Also, rights come with responsibilities. And if you're going to exercise a right, it's got to be in the context of the situation, of the context of community and relationships. So do I have the right to drive without a seatbelt? Okay, should I be given that right? Well, hang on a minute, who's going to pay for my care in hospital if I were to have an accident? Okay, so I can say, well, I've got the right to have euthanasia, I've got the right to do this, I've got the right to do that. But has the community or the wider good been considered? In the case of euthanasia, that hasn't happened. Just like in the case of driving without a seatbelt, if you wanted to decide to do that, there's a wider issue to be dealt with. So my question is, what poisonous effects will exercising this right to die have on the rest of society? Now, what about having safeguards against euthanasia so that it can only be used in absolutely clear-cut circumstances where there's no hope for the patient? Well, that's how it started in the Netherlands. Okay, I mentioned to you earlier that surveys have shown that in 40% of cases there wasn't explicit consent. Now in the Netherlands you've got euthanasia practiced against babies. That's called the Groningen Protocol. You can look that up if you want. So babies can be euthanized. So they've given consent, haven't they? But the thing about euthanasia against babies is just the natural extension of abortion. Okay? So you wouldn't be surprised about that. People with dementia who can't give consent, and now you can actually request euthanasia if you're depressed or so-called tired of life. Okay, so you're 72, things aren't going so well. Well, I'm tired of life, and that's it. You know, that's now an acceptable. Sorry, you're 84 and you're tired of life. So you know you can elect to bump yourself off. So you can see what happens. It's a pernicious progression of the hopelessly terminally ill to the people with severe suffering, to babies with disabilities, to, well, I'm just feeling like signing out. Okay, and that's what will happen. Okay, and that's why we talk about the slippery slope. And everyone says, oh, no, that won't happen. But you've got to know what's happened overseas, and the same thing will happen in Australia. Okay, so, and what has happened in Australia? Well, when euthanasia was, sorry, this is a bit after euthanasia legislation was overturned, but a woman was given a lethal prescription by a doctor because she was thought to be suffering from incurable cancer-related pain, okay, and she died. So she had an autopsy, and the autopsy showed no signs of cancer. She actually had terrible pain because she had adhesions which could be easily fixed with surgery. Okay, and this is the case that I was talking about that I was an expert witness on, where a GP euthanized 2 patients. So even though euthanasia is illegal now, this is what's happening. So what will happen when it's actually perfectly fine for a doctor to bump someone off? The other important point you should know is that if you allow voluntary euthanasia, there is no logical reason why you wouldn't allow involuntary euthanasia. Okay, and that's because if a treatment is good for you, if you can give consent to it, it makes no logical sense to withhold that treatment from someone who can't consent to it. Okay, go back to my pneumonia example. You come into the hospital and I say, what's wrong? You say, I've got a cough, fever. I have a listen to your chest. All right, you got pneumonia? I'd like to give you antibiotics, Mr. Jones. Okay, yes, doctor, I'll take the antibiotics. So there's consent to treatment and I give the treatment. Okay? Now, let's say Mr. Jones came in and was semi-conscious from pneumonia and couldn't give consent. Do I say to him, well, Mr. Jones, I'd like to give you pneumonia, what's your opinion? And he's just lying there unconscious. And I say, well, I don't really have consent, so I better not treat him. Okay, you can't do that. You would just institute treatment. The same thing happens with someone who requests euthanasia. If euthanasia is a good treatment and someone can request it with full level of awareness, then it would be wrong to withhold it from them if they couldn't give full consent. Let's say if they were confused or for some reason they just weren't able to fully understand everything about euthanasia and weigh up the pros and cons of the treatment, you couldn't make a rational argument to withhold it from them, because every other treatment in medicine can be given to someone if they don't consent to it, if it's a life-saving treatment or a good treatment to give. Okay? So there's no reason to withhold euthanasia from people if they can't consent to it if you allow voluntary euthanasia. So therefore, voluntary euthanasia will definitely become involuntary euthanasia. So if you're looking at safeguards, the only safeguard you can have is to change the way we view life, okay? People need to understand life is precious. Old, frail people and those with advanced illnesses are not a burden on our health system, okay? They need our love, protection, care and support. They deserve good care. They don't deserve bad care. They don't deserve someone who's only willing to give them 5 minutes of their time. Okay. Allowing a view that euthanasia is a good answer to some difficult medical problems inevitably leads to corruption in the way life is viewed, and that's exactly what happened in Nazi Germany. Okay, so Dr. Karl Brandt, who was the Nazi doctor that was in charge of the euthanasia program, this is what he started off as just like any ordinary doctor. Okay, he went through medical school. He would have gone through med school wanting to help people, but his conscience was not formed in the right way. Okay, my underlying motive was the desire to help those who couldn't help themselves. I didn't feel in any way this to be unethical or immoral. I'm convinced that if Hippocrates were to be alive today, now Hippocrates was the guy who wrote the Hippocratic Oath, which says that I shall not give lethal injection to anyone, even if they ask of it. Okay, so that was well before the time before Christ was born, okay, and before the Catholic Church was started. So he said that I'm convinced that if Hippocrates were alive today, he would change the wording of his oath in which a doctor is forbidden to administer poison. I have perfectly clear conscience about the part I played in the affair, so his conscience wasn't properly formed, so anything is fair game. And I did so with the greatest conviction, just as my conviction is that it's the right thing to do. And he said that in the stand in Nuremberg. Okay, so even at the end, he just couldn't work out what he was doing was wrong. Okay. So what impact will it have on doctors and nurses? Well, a lot of us are worried about what this will mean. Okay? A doctor is going to have to be forced to learn how to kill a person. I actually don't know how to kill a patient. I wasn't trained to do it. I mean, I guess I could, yes, you could draw up, 500 millimoles of potassium chloride and inject it into someone and they'd die, but I wouldn't know exactly what the dose to give is, so I'd need to be retrained in order to how to kill a person. So suddenly the role of a doctor is corrupted into becoming, instead of learning how to protect and defend life, they're going to start teaching doctors how to actually kill people. You'd be forced to discuss euthanasia as a legitimate option by administrators in hospital. Okay, so the hospital's full. There's 100 patients waiting in the emergency department for a bed. The next thing that will happen is the doctor will get a call from the Director of Medical Services saying, have you informed this patient of all their rights? Okay, so it would lead to a corruption of the patient-doctor relationship. Relatives of people in comas might start asking for lethal injections. Okay, so in New South Wales anyway, and I presume in the other states, there's the surrogate decision maker is called the person responsible. So for example, if I wanted to operate on someone who's in a coma, I'd have to ask consent from the person responsible. So the same thing would happen in the case of euthanasia. You'd get someone saying, well, I elect to have euthanasia. Okay, so imagine what a terrible situation that would put doctors in. And as I said before, what would happen to palliative care and geriatric medicine if research, what would happen to research in these specialties if euthanasia is allowed? One of the things you should be aware of is that euthanasia advocates who supposedly champion an individual's right to make these decisions for themselves, they don't want to extend that right to a doctor who objects to this treatment. Okay, so they want you to have only one consult with another doctor as to ascertain whether or not you're suitable for euthanasia. Okay, you're not allowed to get any other opinions, so I'm not allowed to ask for 5 other doctors and see what they think. It's just one doctor is enough to sign off on your life. If you fail to refer patients to someone else, then that would be a prosecutable offence. And that was the legislation in Victoria that they tried to implement. So if a patient came to me and said, look, I'd like to be euthanized, and I said, I don't think that's the right thing and this is why, if I didn't refer them on, I would be in trouble. And that's also the abortion legislation in Victoria. So, excuse me, but doctors are really worried about this. So please get to writing and speaking to your local members. So the euthanasia advocates will force euthanasia onto doctors with little opportunity to practice good palliative care and show love and care to patients. So who would have thought the Greens would share a Nazi philosophy, eh? Isn't that a surprise? Yep.
I would.
Yeah.
I've studied them for a long time. It's
Yeah.
always been in their platform.
That's right.
They're tree huggers.
Yeah. Well, they supposedly are opposed to Nazism, but it's exactly the same philosophy. Just a point on tree huggers, by the way. I'm a tree hugger as well. I mean, you know, like every party and every person of rational mind, and as I said earlier on, all life is special. Everyone wants to protect the environment. Okay, it's essentially the same philosophy on that. The Greens have a different agenda. Okay, and that's what you need to know. It's got nothing to do with the environment, most of their policies. Okay, so who would do research into palliative care if euthanasia was legalised? Okay, euthanasia, it's cheap, it's effective, supposedly effective. So by definition, market forces would not allow research into other more expensive treatments, okay? And there's no research anymore into old-fashioned cataract repair or to open operations for removing your gallbladder. Okay, there's a much cheaper alternative available. So the same thing would happen to geriatric medicine and palliative care. There wouldn't be research into those areas of relieving suffering because there's a much more cheap treatment available. So, the big answers. Okay, I asked the big questions. Now here's my big answers. Is it the best medical care? Okay, no. A noble profession with cutting-edge scientific treatment is available, palliative care, which offers safe, effective treatment which upholds the dignity of patients. Why settle for a second-best crappy treatment? Is euthanasia the most loving response? Okay, it's a quick fix. Okay, so what do you think would be more loving? And as I said, it fails the sniff test. It stinks. Okay. Should we bring in euthanasia? Well, the popularity is based on flawed survey techniques. And popular opinion is not something you can rely on to decide important moral questions. And as I said, remember that many people who suffer terribly don't have a terminal illness. Okay, will it allow patients to be more autonomous? No, it'll reduce their autonomy. I already know how to increase someone's autonomy, and it doesn't involve euthanasia. And doctors end up making the decision anyway. Won't there be safeguards? Yes, absolutely, the same safeguards that there was in Nazi Germany and in the Netherlands. Okay. And once you accept it as a notion for voluntary cases, there can be no logical or moral objection to involuntary euthanasia. And what impact will it have on doctors and nurses? It'll force people into killing. You'd have to learn how to kill, and research would go down the tube. Okay.
So, excuse me, sorry, we're kind of a
Yep.
little bit over.
This is my last slide.
Oh, okay, good.
Sorry, so something to think about. So Blessed John Paul the Great said in his letters that euthanasia is always an intrinsically evil act, a violation of God's law, an offence against the dignity of the human person, and that older people should be esteemed and valued. And the current mentality that considers our brothers and sisters as useless when they're reduced in their capacities, the current thinking is that they're useless when they're reduced in their capacities due to sickness or age. So, right.